I'm Dr. Toby Mayer of the Beverly Hills Institute of Aesthetic and Reconstructive Plastic Surgery. Each year we have patients bring us pictures of eyes they like. That gives us an idea of what they're looking for, because very often patients can't verbalize exactly what they're looking for. So this year a very popular patient selection was the Duchess of Cambridge. Gee, I can't understand why. She was on every cover of every magazine and on every television show you saw for months. And you see, her best feature is she's always smiling. She always has a very good smile. She has excellent brow position. She doesn't have any bags under her eyes. She has beautiful eyes. Her face has relatively good composition and harmony. According to Da Vinci, 1/3, 1/3, and 1/3, and she fits into that general scheme. It's interesting to note that this is not the most perfect of noses, that her tip is somewhat bulbous, and she has a little depression on each side just above that. But you don't notice it because the overall package is good, and that's a minor flaw in perfection. So would we tell her, oh, you need to get your nose done? No. If something bothered her, then you would say, okay, well, that can be fixed conservatively. So if we just look at what do patients like about these eyes, good brow position, no bags, right? Now we go to this patient. She said, oh, my friends are telling me I look tired all the time or angry. And I don't know what it is exactly that I need. We say, well, your brows are actually in good position, but you have this excess. So she doesn't need a forehead lift. What she needs is the skin removed from the upper, a little bit of the excess skin removed from the lower, and the bags removed. And she's had that done. You notice her brow position has not changed. She has an incision under her lashes, which you don't see, and the excess skin and bag has been removed, and she looks now happy, alert, and doesn't have that tired appearance. So she wasn't born with good cheeks. This is not an aging problem. This is a congenital problem where some of us are not born with real prominent cheeks, and you can have cheek implants to fill that out and create a much more harmonious appearance of all the parts. So good eyes should have good brow position, no excess skin in the upper lid except a little tiny fold, and the lower lids should not have bags. As we get older, the brows tend to fall, so at some point later on in 20 years, she may need to have this tweaked with a little bit of a brow lift. Also, her aging in here will occur with excess facial skin and or fat, because that happens to all of us. You can see many, many other examples of problems like this on the website, and you'll see patients who have large bags, tiny bags that we remove through the inside of the eyelid versus making an incision on the outside.
You make me feel so young. You make me feel so spring has sprung. And every time I see you grin, I'm such a happy individual. The moment that you speak,